It's Wednesday night, and we're live from Oakdale, Washington, in the Educated Touch studio. Welcome to Ethics Outside the Box, with your host, Nathan Nordstrom. Special guests include Stephanie Jensen and you. Here he is, Nathan Nordstrom.
Well, hello everyone. Welcome to the podcast today. This happens not to be Wednesday night like it usually is. However, it is kind of Wednesday night-ish according to the podcast. We had some technical difficulties on Wednesday, so now we're actually playing this game the following week on Monday. But all of that said, we're still going to have some wonderful, interesting discussion regarding ethics. And so let me boom and boom. And I'm going to have us get back to our wonderful, wonderful, wonderful place that we always like to go, which is to the National Certification Board's website, which happens to be loading right now. But we always want to know that when you are looking for your code of ethics or code of conduct as a national certified massage therapist, you can always go to their website, go to the very bottom, see it says code of ethics right there. Now, the interesting part is the code of ethics for most state licensing boards used the National Certification Board's code of ethics to kind of manipulate, organize, and keep a steady standard code of ethics for us. So this is a place where you can go and kind of say, hey, what are they using nationwide to kind of give us an idea of what each state is requiring. If, for some example, you decide to move across the country for some silly reason, I've done that several times, this is also a great way that you can go through and kind of get an idea of what's standard in the profession. All right. So one of my dear friends is joining us today. Stephanie Jensen is here. She is going to be talking with us about number 5 for it is 5. Yes, 5. Whew. Okay, number 5 on the Code of Ethics, just so that we can stay focused and stay connected. I wanted to make sure to pull up the NCV Code of Ethics here so we can read it together. Stephanie, can you see the Code of Ethics, or is it kind of blurry?
No, awesome. I can. Well, I don't have my glasses on, so.
It could be blurred to everybody, but who knows?
It could be.
All right, so number 5 is provide treatment only where there is reasonable expectation that it will be advantageous to the client. You know, all of these I always like breaking down, and all of them kind of go right on top of each other for what it is that they do and what it is that's important about them. What is one thing that you pull out, Stephanie, that you think is important?
Besides the whole thing, when is it advantageous to, well, as far as I'm concerned, to continue, or even treat, period. We got to know that we're beneficial and when we're not.
Well, and I love the term advantageous, the concept of advantage. There's an advantage to doing this versus not an advantage to doing this. You know, it's really hard to connect that at times and say, hey, you know what? I really do feel that this is important. And the reason why it's important is, if you know that statement, then you're good. As soon as you say, I just kind of want to give you a rub, I'm gonna just push the skin around and see what happens.
See what happens.
That's not where we're actually meeting this standard, where we're meeting this code of ethic. And so really kind of connecting with that, it has to be advantageous, but I always like going to the beginning, providing treatment. We're actually doing something.
Doing something.
I know massage therapists who say, massage, it really can't hurt people. Except for the people that I know who have been hurt by massage therapists, including myself. It can hurt you.
It can. I've hurt people.
Yeah. And you have to be looking at the treatment to kind of say, okay, there's a value here and there can be a challenge here. So when we look at really treating people and working with their condition to improve, do we know when it's going to be beneficial? I know several deep tissue massage therapists who go in and say, you know what, you're just going to hate me for the next 24 hours so it'll feel better. That's a dangerous statement, but I understand how they can connect with that because they're taking the cause and effect and they're saying, okay, here's the benefit and here's the challenge. If we want to get to that benefit, then we're justifying this type of discomfort to get us to a better place. I understand that. The challenge comes when you don't meet that credential, which very few massage therapists can guarantee that it only hurt for 5 minutes, that it only hurt for 1 hour. Because if you're rolling that dice that far, the likelihood that it will go longer is higher. So there's the gamble that goes in there. And I prefer to stay away from the gamble. I prefer to get back into the things that we know and the things that we can prove that will be valuable. And so looking at treatments that are successful and why they're successful, that's a really important piece. Only where it's reasonable expectation. That kind of goes right back to that gamble, doesn't it?
Yeah, well, it really does. And have you set up your expectations for yourself and for your client? Have you reviewed those? Do they sound reasonable, right? Reasonable. Those are SMART goals.
Oh, SMART? Oh.
Right. And then, are they time specific? Are you checking in? And how long do you give it before you say, okay, this is no longer advantageous? What we're doing isn't helping. Do we shift or do we refer out?
Wow. And gosh, so many times I've looked at, as a massage therapist, seeing massage therapists, and I was guilty of this once, of just saying, oh, has anything changed in your health history? Okay, hop on the table. And I didn't actually ask the deeper questions that actually then looks at a treatment plan and saying, hey, you came in 6 months ago, nothing's changed, but are you feeling any better? Are you feeling any worse? If you can't balance both of those, then you start seeing that challenge. You start seeing those issues that come up. So it's really interesting to kind of go into, what does your intake interview consist of, so that you can build this important relationship with the client to say that, yeah, they know what the expectations are and you know what the expectations are. Because if you know the expectations and they don't, well, that's useless.
Yeah, communication is, in my opinion, communication is absolutely key. Whatever you need to know, you have to ask really good questions. You have to ask really good questions, and you have to engage in communication. Some of the things, and I've got clients, I'd be sitting here lying if I didn't tell you that, I have some clients that come in every few weeks. We kind of know what we're doing. They just want to relax, or they'll tell me what they want today. We get into conversation, and then, we kind of find out along the way. I don't advise that for brand new people by any means.
For anyone.
For anyone, probably.
Yeah.
Yes. But you got to ask questions before they get on the table. You've got to know where they are. And if you're on a treatment plan, especially, you've got to check in, and you've got to know, how did you feel an hour afterwards, 2 hours, and get them to explain. My big deal is that I want to know exactly what you're feeling. And if you've got to give me metaphors, that's fine. Did you feel like you got hit by a freight train, or did you feel like you had a light workout?
Those 2 great examples.
I want to know the difference, because if you feel like you got hit by a freight train, I was wrong in my treatment, and that needs to be adjusted. Absolutely.
And you want to not only have a good intake interview and good check-in, but I'm a big fan of creative intake interviews. And as you said, examples, just kind of something that's abstract. I had a therapist who said, well, if you can't explain your pain, what color would your pain be? And I went, kind of bluish. And he's like, okay, so is it kind of a cold and deep pain, just kind of stabilizing, but not really sharp and shooting and hot? I'm like, wow, yeah, it kind of is. And so being able to use something that a client could connect with in a bizarre way can sometimes open those gates. I guess the example that has been running around my mind as I've been talking about this one was one where I did it wrong. And I think we have to have people who are willing to say, hey, you know what, I screwed up in the past so that I can improve, and give that opportunity for other people to learn from.
Mm-hmm.
I used to own a spa in Portland, and the spa, we had a bunch of massage therapists, a couple of estheticians. It was a fun little place to be going and organizing. But I had a client who came in, and we hadn't seen him for a long time, and he came in, and I looked at his health history form, which was a 3x5 card, which I don't suggest that either. But the little 3x5 card, I flipped it over and saw the little writing on the back from the therapist, and put it away and asked any questions. Hey, any problems? He got on the table, and I started working on his back, and by gum, the knots on his back were just rock solid and huge, right in the paraspinals, or the erector spinae, right next to the transverse and spinous process. I worked on those for about 20 minutes. When I finally got done, I was like, something, I've never felt knots like this. Let's have you roll over. So he rolls over, and he's been cut from his sternum straight down, and he had a quadruple bypass here, in the last month or so. And he didn't think that was an important thing for me to know. And so I had to stop the session at that point. I said, massage therapy does affect your circulatory system, and your circulatory system, per se, is having challenges right now.
Yeah.
And so it's my job to make sure that you stay safe. And so my expectation is that you'll probably be a little sore from what we did, but it makes sense to me now why those muscles were hurting that way, because your muscles have never fired that way. And so being able to refer and tell him that he's going to have to wait and get a doctor's recommendation for massage, because he hadn't thought about that either, that he really needs to talk to a doctor about it. That's that piece where it's like, okay, we need to start reminding our clients and patients when they come in, that massage therapy doesn't just feel good. It does, but it doesn't just feel good. It does other things, including change posture, change muscular stability, and increase your circulatory response, as well as many other things that science is continuing to show. Any good examples where you've seen a client and you've seen reasonable expectation that has come out and that it was advantageous for that client?
In a good way?
Let's start with good.
Okay. In a good way. Oh my gosh.
I think the hardest part on this one is that most of them are that way.
Most of them are that way.
Yeah.
And a huge portion of my clients, we do treatment plans. So I don't have very many that are, they just keep coming in and keep coming in. We do treatment plans. So we do the constant check-in. And when it's time, to move on or back off, or, hey, maybe it's time to move on to somebody for more, just maintenance, repetitive stuff. I've got back injuries and ankle injuries and shoulder injuries.
Not on yourself.
Not, yes, but
okay,
no. Clients. And so, most of them turn out. I've had to learn the hard way on a few of them when it was time to refer out. Those are probably easier to find.
I think the easiest piece on referring out, and the way to make it a successful referral, is to have a community connection. Being able to know the people in your community, so that you can say, hey, what you were talking about doesn't fall under massage therapy. So I do have a counselor's phone number here if you would like to see them. If you already have someone perfect, I'd suggest that you go that direction. But referring out to the right person in the right place. Right.
It is super important to have. I have a stack of them, and you can. I suggest going out and being in the community. Go to Chamber of Commerce and get to know other business people. Rotary Club, whatever, Seroptimus. Get together with other massage therapists. Find out what kind of community groups are in the health industry, and make sure that you're referring to professionals, and then meet them face to face. I have a handful. I don't just refer to the same people just because, oh, I like this one person and we go have coffee every Tuesday. I try to find out what my clients' personalities are, and then help send them in the right direction as well. Because I know people who've gone in and said, hey, I tried that one physical therapist and we just weren't a good match, and it was just a personality thing. It was, maybe a really bold woman with a more quiet male therapist, and wanted somebody who was a little more intense and going to push her a little harder, or something along that line.
I look at the different groups that you can connect with. I like Rotary Club and those that you were talking about. I know in the larger cities, they'll have like chapters of the American Academy of Pain Management, or they'll have medical groups or doctors groups or chiropractic association groups that meet together. And everyone thinks, oh, those are for the doctor and for the chiropractor, for them. Not true. They actually, you get a lot of insight and connection by attending those types of meetings and connecting with them. As I've gone to the Academy of Integrated Pain Management, yes, I was one of the very few massage therapists there. However, the real big joys of that were that when they had a question about massage therapy, they'd say, oh, you're a massage therapist? Oh, hey, I was working with this patient that had this problem and that problem. Do you think massage therapy would be beneficial for that? And there are sometimes I can say yes, and sometimes I can say probably not. And because I have years of experience, that's where I'm basing that knowledge off of. So being able to kind of have strength and getting out to the community so you can know where to refer, and how to be advantageous to the client, not just in your treatment, but also in your referrals. Because what does that actually say when you refer out to someone that they love?
Well, that you know that you're good. You know what you're talking about.
You know what you're talking about, and they'll say, oh, you know what? I want to go back to that person.
And they're going to really appreciate it too. And they're going to trust you. My clients come to me all the time and they'll say, hey, what do you think this is? And I'll say, well, I can't tell you what that is, but it's in your shoulder. So why don't you go and see, your doctor and ask to see this orthopedist?
I still really love the concept of, well, I'm noticing a lateral curvature in your spine. Because that's about it. I mean, now, will a doctor diagnose that as something else? Yes. But I'm not there to diagnose. I'm there to assess the condition and I can give understanding of the assessment. Here's what I said. I can write that down and give it to them, and they can take it to their doctor and say, Doc, I have a lateral curvature of the spine according to my massage therapist. And they can go in and palpate and go, oh yeah, look, your spine does do that. Guess what? You do have a condition. Here's your diagnosis. That's almost to me like that comedian who says, here's your sign. I think here's your diagnosis. Yeah, very similar in that. But being able to also refer out to another sector, because we've talked about referring out to outside of the profession. You're right. There have been people who have been referred to me because I have a client who says, oh, you have to go see Nathan. He's the bee's knees or whatever. And so they come in and they're like, I didn't really like it. What is it that you're looking for in a massage? So I can refer out to a massage therapist who will kind of meet your needs and help you. Being able to refer out that direction is, in my mind, just as important as being able to refer to a massage therapist or to a chiropractor or a physical therapist or anybody else, even referring them back to their MD, who they hopefully have a relationship with. But being able to have other people in your professional circle that in that community. I got praised by a client who had moved. I was working in Gresham, Oregon, which is on the east side of Portland, and they were moving over to Lake Oswego. No, I was actually north, so Lake Oswego, Hillsboro area, and they were like, I can't make the hour and something commute over to you. That's just not going to work. And so because I was active in my professional association, I had AMTA members who were on the west side of Portland, and I could refer them
out.
to them because I had talked to them at AMTA conventions, because I had talked to them at conferences and figured out who's similar to me and who would work best for that client.
Mm-hmm.
Now, did I write a prescription for them to go? No, I didn't. But I gave them a good suggestion to say, hey, here's some places that you might want to look to talk to somebody who does this type of thing.
Yeah, I think that's probably, I mean, as far as ethical is concerned, I think that's one of the most important things for us to get and understand as therapists. You got to be really good at what you do and be willing to know what you're not good at. Which takes me to the story of back when we first started and I called you crying.
Yay! Go for it.
Well, you trained me in treatment, therapeutic, massage, medical style massage. And that's what I loved and wanted to do. And I got my first job and I was told, no, you do what the client wants and they want relaxation massage. And I was horrified one day when I was just going through the motions and went from head to toe down the back, flipped over, went, the rest of the way and looked at the clock and we had gone a half an hour massage.
Time's up, moving on.
Time's up, moving on. So I flipped her over and did it again. I was like, oh my God, I don't know what to do here. And it was awful. And I don't know if you remember the conversation, but I remember going straight out to my car and calling you, bawling my eyes out, saying, I don't want to do this anymore. This isn't what I signed on for. And I needed permission from you or somebody that I respected to say, I trained you better than that. Know what you're not good at, know what you're great at, and go do what you're great at. And that's what I did. From then on out, I found the people who did relaxation really well. And that's the first thing I tell new clients when that's what they want. This is not my specialty. If this is what you want, here's a list of people that are really great at that. And that's where I would love for you to go.
Well, and that's where you didn't just specialize in, okay, you didn't take my advice and go, okay, I'm going to do this. You didn't cut people's heads off and say, I'm sorry, I'm not a Swedish massage therapist. You have to go away now.
To go away now, no.
You took them where they're at and gave them the best option.
Mm-hmm.
But you held true to what's going to make you the best quality massage therapist for the people who are coming in.
Mm-hmm.
I have so many clients who come into me and say, I just don't like foot massage. And I say, well, good, because either do I. My feet are very ticklish.
Mm-hmm.
And I have no problem completely avoiding the feet if the client doesn't want that.
Yep.
And that is advantageous for them because they don't have to squirm through
and deal
5
with
or
it.
10 minutes of, oh, you're touching my feet. And for me, it gives me an opportunity to be the best therapist for them.
Mm-hmm.
One of those things that I keep telling people is you have to be conscious in every massage session. Because no matter what's going on, if you are a Swedish massage therapist doing relaxation-based massage, you may go in and turn off your brain and start doing the same massage routine stroke by stroke and find out that you weren't looking at ringworm on their back, or you weren't looking at a rash, or they have a sunburn, or they have any number of problems
that you have to watch and pay attention to.
You have to be conscious, and your palpation skills have to be there, because that same pressure that you used on that last person may not be enough, or may be way too much. And that's no matter what environment you're in.
You're in, no matter what it is. Yeah, that one, and that takes years to balance as well. I mean, I hate to say that, but you have to learn how to meet your client where each one is individually, and which brings in that, that mindfulness, that presence, that consciousness, that you only go as far as they allow you to, and you shouldn't have to check in every second. Is that too much? Is that enough? Vocally.
You should have that idea of what is right, what is wrong, what is too much, what is not enough.
You should check in too. Don't get me wrong.
You need to. You need to. Because there are signs that everyone knows, but some people don't listen to, and that is how's that pressure? It's fine. You know what that actually means?
It means it's not fine.
It's
Yeah.
not good,
Yeah.
or it's all right, or I can take it.
Oh, that's a good one. I
Yeah,
can take it. It's all right.
Really?
Why are you taking it?
Let's make this a little bit better instead of just taking it. And so being able to connect with that and kind of say, wait a second, what is it that we want to do to make sure that they're getting the best session possible? Because that's what we're looking for, is
That's what
getting
we're
them
looking for.
that best opportunity. Now, let's go with those examples, those negative examples. Any negative examples where someone has not been working for the best benefit of the client? Anything comes to mind there?
Me personally, or just anybody?
You can go with stories that you've heard. As I said, there were a lot of anecdotal stories when I went to massage school. I think everybody had anecdotal stories that they learned from. Research would be better, but oh yeah.
No, I think anytime that I walked into the room where it was about needing the money and I wasn't there fully, that certainly it's not advantageous. It's not beneficial for the client whatsoever. Here we go. And this is a hindsight, being 2020, recent history. So my mom passed away in October, late October, from cancer, and I had been her primary care person for about 8 months through that. And I went right back to work.
Oh.
Oops.
Yeah.
And there's this little thing that I call it grief shock now. Because really you're in shock. You don't, and when you're in shock, you don't know that you're in shock. You depend on other people to tell you that you're in shock, like an EMT. But there's no EMT for grief, right?
Nope. Darn it.
And so that's a hindsight, being 2020, and that I shouldn't have been there. It wasn't good. It didn't hurt anybody. It didn't do anything, obviously wrong, but it's certainly, people were paying me for my time and they didn't get 10% of my availability.
I love that statement, because so many massage therapists say, well, I'm given a good 70-80% constantly, so that should be enough. And I don't agree with that statement. I think that statement holds a lot of negative or lack thereof statements, because I think when you walk into that treatment room, just like a professional musician or a professional athlete, they're going to give 110% because they know that if they don't, they're going to fail. They're going to lose their contract. They're going to not be successful on that musical interlude, on whatever it is. And we are professional massage therapists. And that professional aspect still needs to be there no matter where we're at. So giving 100% means doing that intake interview, means engaging and not just going on autopilot. Not to say anything about the fast food industry, because there's good people who work in the fast food industry, but regularly if I go into a fast food restaurant, I feel like the response of, hi, welcome to fill in the blank fast food restaurant. Can I take your order?
Can I take your order, please?
Yeah, no engaging. However, I have had fast food people who say, hi, how are you today? And you're like, wait, now I have to wake up.
Yeah.
I'm good.
Whataburger. Exactly. I'll give him a plug. I was at Whataburger in Texas, and I about fell over sideways at the customer service. I thought, I've been to 5-star restaurants that didn't give me this kind of service.
That's awesome. Yeah, I mean, it is those people who make you kind of go, they're engaged, they're connected, and they want to be there.
Yeah.
Do we want to be engaged and connected, and do we want to be the massage therapist who is there so that the client says, this is the person.
Yeah.
This is
and it's a very intimate thing what we do. people are coming to us, they're paying us money to be the most important person in the room.
Yep.
And we're the professional. They expect us to know more about them than they do.
When
Not
I
that
was
we do, but that's the expectation. So we at least have to show that we are engaged with them, that, and let them know that, yes, you do matter. I'm completely, fully, 100% here with you right now, listening to you. And then we're going to move forward together as a team.
So I also like the other aspect that can be a challenge here for making sure that everything's advantageous, making sure that we're giving a quality treatment. When I was the mean instructor in massage school, who was in clinic and making sure that everything was going right, when someone would come in and they were contraindicated, I had no problem telling the student, okay, go tell them that you cannot massage them today and that they need a doctor's recommendation for massage and that they'll have to come back and be rescheduled. It would torture my students. They hated having to say no to a client because we're in a giving profession. We want to help. We want to give. And the problem was that if I didn't do it then, and I had this in my mind from the beginning, that I've seen people who have come in for a massage and the massage therapist, brand new in practice, is like, oh gosh, I'm having a hard time making ends meet, and so this person I really shouldn't give a massage to, but maybe I can justify some other treatment or justify a reason to get them in. And as you said earlier, chasing the money is a challenge. And so being able to give people that importance, that the client comes first and that it's important that you are taking care of them for their best interest, that's when you start saying, oh, okay, now I know that I can tell a person no, because that's hard.
Yeah,
there are times when I should tell a person no, and that I can still feel comfortable telling a person no. Just like, so I've told clients no several times.
10,000 times.
Over this many years, I don't even know.
Over 15, 20 years, 30, well, not 30, but we're not that old yet.
But over the years, being able to kind of see that, I've also noticed the other aspect, where you told a client no, and they came back later with that prescription from the doctor.
Yeah.
And said thank you.
Yep.
The doctor didn't say I need anything, but he was glad that I came in and checked in. Yeah, I was complaining about. I had a client who was complaining about just kind of the sweats. Their heartbeat felt a little irregular. They didn't have the exercise, so I said, you know what? Let me just pull out the blood pressure cuff. Let's take your blood pressure, see what it's at. It was through the roof.
Oof.
And I said, yeah, massage is not going to be beneficial here. How long have you been suffering these symptoms? And he told me, I said, you need to go see your doctor and now, and go see if you need to get that taken care of and how to get that taken care of. He went, he got his blood pressure medication all under control, and he came in and he's like, wow, I feel better than I have in a long time just because I listened to you and went to my doctor. Thank you. And then we could start working on him after his blood pressure was under control to help him with his posture and to help him with his aches and pains and the muscle tension that was there.
Where it was advantageous.
Yeah. And that's where it should be, is kind of being able to first take yourself out of it and say, what is my job here? And be connected. Now, I'm trying to remember, there was another story that you had last time we were talking.
Yeah, we're coming to that.
You want to toss that one in?
Yeah. Well, probably my scariest one. But and as I say, I guess here's where it gets tricky. So I had a client who came in. He had been, I don't remember if it was right or left side, but he had pain under one of his scapulas. It had been going on for quite some time. He had been to several doctors. They didn't know what was wrong with him. They sent him off. They said, hey, go get a massage, go exercise, go do something, but there's nothing wrong with you.
All the good stuff, yeah.
All the good stuff. There's nothing wrong with you. So he came in from a referral, I think from a chiropractor that I know. And we did, so I got him in. We did, I always usually start people with five treatments for, once a week for 5 treatments. And you check in every time. Well, after the 4th one, there was just absolutely, there was no movement. It was not getting better. He wasn't feeling any relief. There was nothing. And it's like, there's just something wonky here and not right. So I can't keep working on you because we need to know what else is going on. Because if I'm not making a difference, something else has to, and you're just wasting your money. And so he went back to his doctor, and a couple weeks later he called the office and they did more research, and he had a softball-sized tumor in his lung.
Ooh, yeah.
Yes.
And so what ended up happening?
He was treated by a doctor. He had surgery. It was removed. I don't know where he's at now, but he was recovering from that last I knew. It wasn't a non-curable cancer, but that's a big deal. And I had to let him go.
Yep. Yeah.
And I'm glad I did, because if I didn't, how long? I mean, it could have been a lot longer, and that tumor may have caused major problems, maybe pushed against the major artery. You've got your superior vena cava that runs in there.
How long until it would have been respiratory or metastasized to something else? I mean,
something else.
You never know. And it's our safety procedures and precautions that keep not only us safe, but really allow for other people to be safe. I think last week I used this same example, the number of massage therapists that I know who have spotted an abnormal growth on someone's back.
I've done that a few times.
Yeah, you don't know.
Knock on wood, it's never been anything
malignant.
Scary, but they go get them checked out.
And I actually got a email back from one of the doctors of one of the clients that I had who I sent off. And she said, thank you. Thank you for being there, for looking at it. The American Massage Therapy Association for several years has had a relationship with the Academy of Dermatology. And had doctors from the Academy of Dermatology come in and talk to different groups, as well as for massage therapists to go in and talk to the Academy of Dermatology. And there's some really great classes online about how to make sure and how to look and how to really connect with what is something that you're scared about, and how do you make sure that you are the best practicing massage therapist to keep your clients safe from skin cancers. And
which is really important. With permission, sometimes depending on, I've taken pictures and kept pictures in the file and sent them to my clients, circling the ones that, we were paying attention to.
See, I really do. I personally frown upon having a phone or a camera in the treatment room because liability reasons. However, I have several times asked the client, hey, do you have a camera on your phone so I can take a picture of your back with your camera? So it stays on their documentation. It is there, and they can deal with it however they want, and they can bring it to the doctor. Anytime that they do decide, hey, I'm going to go to the doctor now, they can go, and they can take care of it. Or they can come back the next time and say, hey, you took a picture last time, you want to take a picture this time too? And you're not going to get exact length, exact height, that kind of stuff, but you will then consciously go, oh, wait a second, what was it that I was looking at? And then you'll see those things and you go, oh, okay, let's see, does that line up? Okay, perfect, let's take that picture. Perfect, now we know. It's a great tool, and it's a tool that we didn't have 15, 20 years ago.
10 years ago.
But we're starting to see that more and more and more, and it's a huge benefit to connect with. So there's one other piece here that I really have to talk about, and that's communication. When we're talking about making sure that your session is advantageous to the client, the way you communicate should never be about you.
Nope.
So if you're in a session, I'm going to toss myself under the bus. I've done this, where I'm in a session and I'm talking to a client, making sure everything's going right and going through, and they're talking about a story about something that happened to them. And then I'm like, oh yeah, something like that happened to me. And I toss in my story. Did that really help? Was there really a value in sharing personal information? Now, I've heard both arguments on this. What side do you go? Pro or con or both?
Well, okay, well, communication is a really important thing to me. So is rapport, and it's a slippery slope. It's a really slippery slope, because your clients they want to know a little bit about you. They want to, so a little bit of comfort, that they have something that they can connect with. But that doesn't mean you're an open book or you share everything. And here's my absolute no. You don't use your session as a bitch fest for yourself.
Amen. So I'm assuming we both have seen that or heard about
or
that.
Done it.
Or done it. I know several times when clients have come in to me and said, are you going to talk the whole time? And my first answer is, do you want me to talk the whole time? And the whole time, the first thing they say is no. I'm like, perfect. You decide how much you want to talk. I will check in on you a couple of times. But notoriously, and I think it's partially my communication style, people are comfortable talking with me, talking to me. And when I'm working on people, I'm checking in on, hey, here's what this muscle is, here's what's going on here. And so people feel like they're not just in a session to be worked on, but they're in a session to be educated, to learn, to experience, and to know more about their body.
Yep.
And so a lot of times they end up.
That's my talking most of the time.
Gabbing. Yeah. Just allowing people to gab and experience and understand more. I'm always a big fan of that.
Yeah.
So go ahead.
Oh, I was gonna say, so like I said, it can be a real slippery slope. Like, I've talked about the fact that I have a husband and I have a 13-year-old boy, or, connect a few things like that. But, it's important to not talk about particularly personal experiences, or if you're having a bad day too.
So I closed out a practice in my history of years, more than once, as I've traveled across the country and stuff. And I had one office that I closed out, and I had a client, and you were talking about you follow a treatment plan, and there are clients that I have that I tell them, I'm just an aspirin for your condition. I'm not fixing anything. You're the one who's going to have to change it. You're going to have to, and they keep coming back. And so I saw this guy weekly, every couple of weeks, something of that nature. And by the time I had to close down the office, and tell him I was leaving practice, he said, can I have one thing? I'm like, what's that? He says, can I see a picture of your wife and kids? And I sat back, and as I was continuing the session, I'm like, even if you passively talk about your spouse and your kids once in a great blue moon, it all adds up until people kind of have a feeling like they know about your family and about, they talked about their pets, and you're like, oh yeah, I have pets too. And they're like, oh, okay. And so they get to build this vision of what they think you are. And so when I got my phone out and showed him a picture of my wife and kids, he's like, oh, that's really good to put a face with them. Yeah, they just seem like the greatest people. I'm like, oh, good, I said the right things. But I mean, I brag about my wife and kids all the time, so I didn't have any concern about that. But it's really interesting to hold on to that balance of human communication and over communicating, and really kind of getting into almost they're your therapist type
kind
response.
Yeah. Well, I do coaching now too. Well, so what I've done is I've just integrated in, what are you doing in your life? What other things are going on? Here are some other tools that we can use. But the point is to ask really good questions and to always refer back to them, never, it's like, oh, okay, you want to ask questions about me? That's fine. What do you do? Oh, well, I go to the gym a couple times a week, and I really work hard to drink all my water, and I go to yoga once a week, and here's a great place for you to go do yoga, and right back.
I like the 90-10 rule, and they give you 90%.
90%, you give 10.
They give you 90%, you give 10.
Mm-hmm.
Because it really only takes open-ended questions, very limited response, for them to actually start biting and pulling out.
Mm-hmm.
You do get that client once in a while where you give them an open-ended question, and they're like, yeah, kind of, it's all right. All right, so we're going to have a quiet session.
We're going to have a quiet session today. Yep.
What they actually said is, I don't want to talk during the session. I'd like to just relax.
Mm-hmm.
Wonderful.
Yeah.
How we know, and they're building the amount of communication.
Yep.
You're following through with that. I don't have a lot of clients who just want silence for an hour, but the ones
that's not my practice. But every now and again,
and you get that person.
You get that person, or they'll just say, hey, you know what? Today I'm just really feeling like I just need to breathe today. Awesome. Let's do that. And then they'll breathe, and 15 minutes later, they're chatting up a storm. Or they're not. But it's really up to them.
Yeah, and it is. It's really making sure that it is about their session, about their abilities, their limitations, their passions, and the things that they want to do, so that they can have the best benefit there.
Mm-hmm.
All right, so let's quickly go back to this page here. We've got number 5, and we're just going to recap and make sure that we've got everything talked about that we kind of need to. Provide treatment only where there is reasonable expectation that it will be advantageous to the client. I like the term only.
Mm-hmm.
There are big words and small words here, and sometimes the small words really kind of go out to the big words. So when I kind of look at the word only, this to me means you're full bore, you're fully on, you're fully connected. You never do something that isn't appropriate. You're always connecting, you're always sharing and making sure that it is right. And if
you're not, it's no longer reasonable.
Yeah, exactly. I was just talking with a spa who's has very limited expectations on what they think a massage therapist should and should not work on. And the spa is set to say, this is what your limitations are. And when a massage therapist who works there goes over those boundaries, they fire them. It is here is our black and here is our white. So as the massage therapist, if I was working at a spa with stringent rules, I wouldn't just know those rules. I would take a step before those rules and say, okay, here's where my boundary is. So if I pass my boundary, I will not have gotten to their boundary yet. And that's one of the great ways where you can make sure that you are only providing treatment, or you're providing treatment only where it's reasonable and there are expectations there.
And that should be a standard. We should all know our standard when we walk in, of how we show up and where we go. We know our standards for draping.
Yep.
We know our you can't pass your exams without knowing, right, what your standards of drapes. And I still have a tight drape to this day, very tight. Yes, thank you. It's still very tight drape. As a therapist, I get offended when I don't get a tight drape on the table.
I was at a
which is a
spa.
lot.
I was at a spa and they did fluff draping on me. And I just kind of went, because I knew something was hanging out and showing just
So
where
what
it
are you
should.
doing?
And that's where I say, okay, tight drapes not only make sure that the person knows where it is, but it makes sure it doesn't move.
Yeah, and it's important.
Yep.
And it's I don't know if you can hear my dogs. They're
Oh,
going
yeah.
crazy now.
Well, they got excited. They got
I
excited about ethics.
Yes, I'm gonna say I think that boy of mine just walked through the door. He got his greeting party.
Beautiful. Yeah, so I want to draw this back to a specific group of people because this webinar is going to go to everyone. Anyone can watch it. But really, the people that I think this webinar really pertains to is that person who just got out of school. That person who's in their first year of practice trying to figure out how to make ends meet, how to make their practice grow, how to make themselves the best massage therapist for every potential client. This is kind of one of those basic standards that I think if a massage therapist drew upon this right at the beginning, they'd create a good foundation for them to build everything else on. Now, there's one other thing, and I know we're rolling up to the end of our hour here, but one other thing that I think massage therapists don't get enough of, and this is kind of where your specialty is, and that's business. This concept that when you get through massage therapy school and you're ready to go out and build the world of practice and be all that in a bag of chips becomes a challenge because you may have had a couple of days of business or 1 quarter
or 4 hours
of 4 hours. You had 1 quarter, 2 hours a week or something of that nature. That doesn't prepare you for a good, solid understanding of business. And I think this relates here to number 5 because it's not advantageous for your clients to have you go out of business and have to find a new therapist and go out of business and find a new therapist. This is one of those challenges in our profession that we continue to see. And so making sure that you're financially budgeting, making sure that you're financially organizing your business to be successful, and organizing your personal life to be financially successful are really important because massage therapists don't do enough.
No, this is one area, and I've worked with a lot of therapists over the years. In my area, we're rural. I can't even talk in small area, and so it's important that we all support each other. And I've seen a lot of people go out of business because they didn't know and they didn't understand. They didn't know that you have to set up your practice, that you got to show up when you set a schedule. You have to show up. And you have to know, right? But you also have to know, the last thing you want to do is get caught off guard because the county you work in has taxes for your industry. And some don't. Some counties, some cities don't have taxes for our industry. Others do. So you can't just pay your state taxes, or like in Oregon, we have income taxes. We don't have a sales tax. And so we have to make sure that you're paying your state revenue, you're paying your federal revenue, and you need to check in with your city and your county and see if there's any business tax revenue that you have to be paying as well.
And truly that's for most regions. You need to check in to see that, make sure that you're following the laws wherever you're at. And they don't teach you that. Or at least they didn't teach it, 14 years ago or so when I was in school. The other thing that I didn't teach your business class, right? No, you did not teach my business class. So, but you did say something that stuck with me, and has stuck with me all these years, is that I'm going to teach you just enough to make you dangerous. And it made me set a different standard that I don't want to be dangerous. What does that mean? And then marketing, I learned, over time, that you don't put down that you're a specialist in everything that you might have touched on in school. The very best thing that you can do as a business person is to have a specialty and hone that skill.
If it's Swedish, great. If it's treatment, great. If it's, working with vets, great. If it's working in geriatric, great. But whatever it is, pregnancy, great. But just say that that's what you do.
And own it. Monopolize that market, and you will have people coming from all over the world, all over the woodworks.
You'll never have to worry whether or not you're going to pay your rent this month.
My statement to you about I'm only going to teach you so much to be dangerous, it's a sad, scary statement. It's not one that I like. However, it is also one of those statements that was to be a caution. And I think every massage therapist needs to be conscious of that and looking at the danger that they can do so that they can make sure to be successful. And so next week, we're actually going to get into continuing education. I'm going to have MK Brennan from the Academy for Oncology Massage. And we're going to talk about the importance of good continuing education and good focus of making sure that you're safe for your client and that your client has the best experience. But if you are not consistently engaging in continuing education that excites your brain, you're going to fall short. There's going to be a point where you just kind of go, I'm tired. And I know I hit that early on in my profession where it was 4 years. I was starting to hit that crush. I took a continuing education class and I went, aha, that's awesome. Let me try something new. And having that passion allows you to really help that client be the best they can be.
Yeah, constant growth. At least all the states that require it.
Yep.
Require licensing, require continuing education, and they're really honing in on the quality of that education as well. Yep. And I think it's important. We have to do it.
And there are some states that don't require continuing education. However, if you are in one of those states, I lived in Wyoming for a while, and they don't have licensure. But one of the key things that I really enjoyed and was excited about was that the places that I worked required that you are nationally certified. They required that you held a standard that required you to have continuing education. If you're working in a state that has licensure but doesn't require continuing education, still connecting yourself with a group that really pushes you forward to make sure that you're getting that will set you apart from the rest of the massage therapists in your region. So. Yes. So, Stephanie, thank you so much for joining me. I really do appreciate it. And no problem. And you've called me with bizarre questions, but you know what? I've enjoyed hanging out with you and connecting with you so often. And so, thank you for joining me for this hour and really connecting with me on this.
It was nice to meet you, Stephanie Jensen. Thank you, Nathan. The hour has flown by. We hope you've enjoyed this discussion with Ethics Outside the Box. As you've seen, Nathan uses many second-hand stories of ethical situations. If you'd like to share your story or you have any questions, feel free to contact him and Nathan at educatedtouch.com. If you'd like to register for next week's live webinar, go to shop.educatedtouch.com. Under live webinars, you will see all upcoming webinars. If you have just watched this video and would like continuing education for home study, you can go to shop.educatedtouch.com under the home study options with the date or episode number to receive your exam. If you would please like this video and subscribe to our YouTube channel, we will keep you up to date on new videos. If you'd like to attend one of our live courses, you can find upcoming scheduled events at www.educatedtouch.com. Thank you for joining us today. Be well and have an ethical day.
Thank you, Lulu, and thank you, Stephanie. Once again, enjoy your day, and we will be talking with you again soon.